welcome. I'm Tina. I'm one of your lab instructors. Today we're going to be showing you a patient safety assessment, safety check, and a bedside check as well. So first thing I want to do is understand my patient's isolation precautions, if there are any. I would like to know their patient's name and have an idea of their age and date of birth so you can verify the patient. First thing I do is my hand hygiene. Okay, this happens outside the room before you go inside. And then what I want to do is come in, knock. Hello, good morning. My name is Tina. I'm your student nurse today. How are you? I'm going to ask the patient how they're doing, making sure that their breathing and their airway and circulation is there. What I want to do is, Mr. Smith, I'm Tina. I'm your student nurse. I'm just going to be doing a safety assessment of your equipment here, okay? Okay, making sure that it's working. Making sure you check the oxygen that it's working. Okay, making sure there's an emergency bedside equipment bag that hasn't been opened or used, and there's a face mask and airways in here as well. I also want to have to look at the patient to see how they're feeling, what's their LOC, their level of consciousness. Mr. Smith, can you tell me your name and your date of birth, please? Okay, and then they'll tell you what it is, and you can verify with their armband to make sure that's correct. Mr. Smith, is it okay if I put your head up a little bit? Okay. Do you have any pain right now or any shortness of breath? Okay. Bringing the head up a little bit into a comfortable position for them. You can see there's 4 bed rails up. Ideally, we want to have only 3 bed rails up. The reason is because studies have shown that if there's 4 bed rails that are up, the chances of the patient hurting themselves is greater than if you only have 3. Okay, you want to look to see if the bed is locked and in the lowest position. You also want to check the room for any clutter, spills, things like that. You can see there's a bunch of cloths on the table, bedside table. There's a urinal here. I would like to get rid of these. I also want to wipe down the bedside table as well. And I want to move this bedside table closer to the patient so they don't have to reach. I also check the call bell to make sure the call bell is in reach for the patient. And walking around the room to see if there's any things on the floor, any hazardous things, wires, cords, equipment that you can discard. Okay. As well, making sure there's good lighting. And I think that's it.